السلام عليكم ورحمة الله وبركاته. سعد الله ظهيرتكم بالخير. First of all, I'd like really to thank the scientific committee and organizing committee of this second international conference for their kind invitation to be with you today here. It's always a pleasure to be in any activity of Damy, whether this conference or other activities. I see really a potential for becoming a lead in this area of donor care. So again, back after maybe we had the first meeting on 2019 and now in 2024. So I'm really glad to be here again and share with you some of the topics that usually we don't talk a lot about, but I'm trying really my best to make it very concise and at the point in terms of the donor counseling. Do we have a pointer or any? Okay, I think this one. Okay, so during the next a few minutes, I'll be talking about donor counseling, and beginning we'll define the counseling, and then we'll discuss the importance of having a counseling program in our blood banks, and we'll talk in much details on what stages are there in terms of providing a proper donor counseling. We'll also mention some requirements that to be in place in order to have an effective counseling program. And I will end up with some quality aspects and improvement remarks for our practice in our blood bank to have a very effective donor counseling. So first of all, let's define what is a counseling in general term. Usually when we have a problem as a personal issue or personal problem, we go to somebody to help us to resolve this. We seek some helps from somebody who either has more experience or more knowledge about some particular things, and then we decide the next step. This is basically the counseling. And the healthcare, it is defined as it's a means which one person helps another to clarify his or her life situation and to decide further line of actions. So this is the يعني التعريف المشهورة. When we ask for counseling, we ask for help, but not for everybody, of course. We go to somebody who has experience, has knowledge, to guide us to the next step, whether we want to do any action or we have more than one choice, so we are confused about it. So counseling would usually help us to decide whether we do this or do that, or we do neither of them. And the blood transfusion, this can also be defined in the context of blood donation. So it is basically, as defined by the WHO guidelines for blood donor counseling, it is a confidential dialogue between the blood donor and a counselor or a trained counselor about issues related to the donor health and the donation process. And this is, we usually do it in the blood banks, but most of the time we don't call it counseling in this terminology. But this is done at different level of interaction with the donors. So when we talk about counseling, actually it is integral part of the process of donor selection criteria. We know that the two things we always consider in the blood transfusion is to have a donor who is safe, both for him and for the patient to donate blood. So to ensure that, we always have some actions to do to make sure that this donor is safe when he donates, and also his donation or collected blood from this donor will not be of any harm for the patient. Blood donor counseling must be effectively integrated in all stages of blood donation process. As we've seen this morning with the presentation from Damy, donor education and donor motivation is an integral part of the process of having a safe and sustainable blood supply. And this is where the counseling should start. So we should go first and educate the donors, give him or her the most information helpful to decide whether he or she can be a blood donor or not. But with saying that, there are few situations that the counseling becomes very, very important. One of them is that when we deal with a first-time or young donor, he really needs to be, to have counseled very effectively, and also at the stage that can help him to decide whether he become a donor or not, whether he is suitable to become a donor in terms of his health or in terms of his safety and blood safety to the patient. Also, another group of people who are more likely to benefit from counseling is when the donor failed the selection criteria. And usually, most of the time, actually, we don't pay much attention about this stage. Donor will be deferred because of low hemoglobin or due to some historical risk factors like travel or medications or for any other risk behaviors. We just defer the donor without actually telling the donor what is the implication of that, when he can come back and donate. So this is another stage we have to always consider when we do counseling. And also we should consider counseling when we have a donor who seeks blood transfusion just for the sake of getting tested for transfusion transmissible infections. We have seen many donors, those who are working in donor area, donors coming actually, they will not tell you that this is the cause, but they are coming basically to check their results for, let's say, HIV. They may have done some risk behavior and they are not sure. So they will come and they will donate not just to help the patient, but actually they think this is the fastest and most confidential way to get their results. So they will come and test. So this is very critical. We have to explain through the proper counseling that this practice is very dangerous. Also, we have also to take care of donors who experience a donation reaction, whether it is mild, moderate, or severe reaction. They need to be specifically counseled and explained about the future donation and what the risk they have. Also, we do post-donation counseling for donors who have an abnormal results when blood is tested, especially those who have infectious disease markers that may or may not be a cause of a permanent deferral. Sometimes it's because of the false positivity or undetermined activity that they can come back later, but we have to counsel them and explain to them all these details. So why actually it's important? For us as a blood bank, counseling is really an ethical issue. We have always to think about it as this is a right for the donor to be counseled. We should tell the donor everything we know about the process of donation, before donation, during donation, and after donation. So it has an ethical side. If, for example, if we don't tell the donor that the frequency of donation more than, let's say, 3 or 4 times per year may actually deplete his iron storage, for example. This is an ethical issue. We have to tell the donor. If we don't tell the donor that if the risk factor that he has due to some behavior will cause the transmission of blood to the patients, this is an ethical issue that we have to tackle. So the first thing that we should think about is the ethical obligations for blood transfusion service to the donors by doing a proper counseling. The second thing, it's a regulatory issue. We have a lot of regulations, and I'll show you some of them, that we have to tell the donor and we have to inform the donor for any abnormal results, but also we have to tell the prospective donors. We have to go one step in front to tell the donor, do not come to donate if you have 1, 2, 3, 4. So it's not only post-donation, it's always a proactive approach. It is also a strong means to help to improve the blood safety. If you explain to the donor all the risk factors and disease transmitted by blood, this will help to reduce donors who may have a risk behavior from donation, and then will have actually the best and the most safest blood supply possible. And also, it will help to increase the blood availability because as I will show you in a minute, the donation experience is very critical for the next donation. If you have good experience with the first donation experience, you will be committed donors. You will come back and you like it. Like what we have seen from Dr. Muhammad about the donor satisfaction. It is actually the more you give them the atmosphere and the care they deserve, the more they likely to come back to you for donation. For the stages that we have to engage with the donor, it could be divided into 4 main stages or areas or lines. The first one is actually the pre-donation information. We have to start from here. Our counseling should be proactive. We have to tell the donor everything that he or she may need to know. It's not only wait for the donor to come to the blood bank and then if he asks, we'll answer him. No, this time we go one step before the donor comes to the blood bank. And also it could be also given during the blood, just before the blood transfusion, as I'll mention. The second stage is the pre-donation counseling. And this is usually done during the process of donor questionnaire and registration and ethical check-up for the donor. The third stage is the counseling during blood donation. And this is also very critical as it is the point that shaped the future of the donor, whether he's happy with the experience he had or not, based on this stage. The fourth one is the post-donation counseling. And I think this is one of the most obvious one that always we notify the donors for their results, especially if it is abnormal or positive result for viral markers. We'll go just quickly through each one of them. Pre-donation information, it actually should contain some elements. It should contain information about the transfusion transmitted disease. Donor also should know actually how the blood bank will deal with him or her, so they should build the trust with the donor. So when the donor coming and answering the questionnaire, have you been outside? Have you had any risk behavior? Nobody will just, if you stop in the street and ask any person, have you had like sexual contact with that person? How do you think the reaction? It will be really difficult to answer, but here we have to build the trust. So building the trust by giving the information to the donor that these questions will be asked for 1, 2, 3 reasons. Also, usually it's given during the registration, although it could be given even before that. And it also can be given either manually as a printed leaflets, or it could be online, and it could be actually very interactive, like the one showed by Dr. Muhammad in the donor information or education, which is really very, very effective way to re-educate the donor before they come to blood bank. It could be also given in a group to people like you. I can say it's a general information, or it could be given to a person individually, but both can be working. However, it's very important to be in a very simple way and very understandable way, very well written. It's not like huge and that would deter the donor from even reading these materials or even go through the process. Abdullah, just tell me the time, because, okay? Thank you. So pre-donation counseling, it's the second step. But we have always to think, what's the difference between pre-donation information and pre-donation counseling? The most single difference is that as for pre-donation information, we give it to everybody. Could be given in general, could be given to many people at the same time. However, for pre-donation counseling, it is actually one-on-one conversation. Here we focus about the donor's specific issues, not as a general thing on the population. Also, it should be it's a part of the donor selection, where we actually give the donor the questionnaire and we review with the donor the questions and the answers and explain any inquiries or any factors that may cause donor deferral. It also involves that the donor will be allowed to ask questions about his why I'm deferred, what I should do next. If I have, let's say, I haven't slept well, I haven't had a meal, if I am on medication, if I have like some infection last week, etc. There are a lot of questions that would cause some unclarity or maybe it's ambiguous for donors to understand. So this is the time usually we should explain to the donor all these things. And also we should get the signature from the donor as informed consent evidence that he was explained and told and understood all of these actions. One important thing actually, and I have seen it many times, we don't pay a lot of attention to counseling deferred donor for other conditions other than like the infectious disease. For example, many donors are deferred because of lack of sleep, for example. Some other donors lack of food, for example. He didn't eat during the last few hours. Or due to some very, like he traveled recently, all these things. Each donor with abnormal finding must be consulted or counseled, regardless of the reason and the deferral period, whether it's permanent, temporary, or indefinite. Counseling during donation, as I said in the beginning, this is where actually the donor experience will be shaped. If he passed this collection stage very nicely, he will be a committed donor. So we have to be really careful about counseling donor during this time, and we have always to keep communicating with the donor, explaining different issues. Like, for example, he should be feeling like comfortable for the experience. We should reassure the donor. We should notice if the donor starts manifesting any sort of donor reaction. And also we have to tell the donor about the post-donation care, what action he or she may need to do. And also to always explain to the donor what action he will be under or he will go through. For example, very simply, we'll explain to him the process of donor arm disinfection, that the donation process will take like how many minutes, what we are going to do. I will insert the needle now, and if you feel like any abnormality or any finding in terms of donor reaction, please tell us. So all this type of counseling as donors donate is very critical. Also, we have to encourage the donor to defer himself or herself if he thinks during the donation that blood may not be suitable for donation. And this is what we call is self-donor exclusion. But it needs to be very privately, very confidentially, to allow the donor really to take the decision. Well, it's actually an informed decision. It could be provided during the donation or even post the donation immediately through a post-donation instructions. The last stage of the donation counseling process is the post-donation counseling, which basically telling the donor about the results and the meaning of the result and what action he or she may need to do. Also, if the donor needs to be referred to a healthcare institution for further management or care. Or also we need to tell the donor who is negative for serology that you are okay and you can come again and keep the good things that you are not infected now. So please come and become a regular donor. Usually we do some actions here. One of them is notifying the donors with the transfusion transmissible infections. And also we do providing the instruction and education about the results. And also we give the donor, we defer the donor in the system. If we have electronic system, for example, either temporary or permanently based on the results. And also we defer the donor or refer the donor for the proper treatment, and also to inform the donor with unusual immunohematology findings. And this is unfortunately is totally not practiced in many hospitals. Nobody care about actually if the donor has like weak D or D variants or have AST positive, for example, or have a rare phenotype. They don't actually think that they need to be counseled. They need to be informed. And instead of discovering this by chance on another occasion. There are usually for notification, there are two models, either direct or indirect, and it's practiced here. Sometimes the blood transfusion center itself communicates with the donor and inform them about the results. Or many hospitals, unfortunately, they delegate this to other third party like infectious disease or preventive medicine department, which has a lot of actually weaknesses which need to be addressed maybe in future. So what we should have to have a proper and effective donor counseling, we need really a national policy. Unfortunately, this is still a weak point. We don't have here, at least until now, a clear guidelines for donor counseling, which is, I think, one important thing, a priority for our colleagues in the blood transfusion service field to start having that. And also we need to have the right infrastructure and sufficient tools to make the counseling very pleasant and very easy for the donor. And also we should have a training program for staff who's conducting or delivering counseling during different stage of counseling. We should also have a quality system for that. And also we should have a good reference laboratories, which is actually now, they are available, but we sometimes have difficulties with confirming certain type of results. For example, HLA-TV, human T lymphotropic virus, or if we have a molecular testing that it's not easy to have an access to confirm the variants of the blood group, for example. We have always to have the proper donor information and donor education materials, which need at least knowledge, professionalism, and also money to do so. The role and the media and the public relation is very critical in giving the pre-donation information, pre-donation counseling, and also to keep the message going on about the importance of the lifestyle and risk factors related to blood transfusion. In terms of quality, we have now in CBAHI, which is the National Accreditation Program, we have some standards that address the counseling, but not directly by this meaning, but you can find them under different sections. For example, requirement for donor education, for consenting blood donors, and we have the two standards, either the hospital standards or the standalone laboratory and blood bank standards, which both have the same standards. And also we have standards for notification of the donor, and we have also standard to give post-donation instruction as a written to all donors. So from what I have seen personally, and I think Mr. Jaffer, who is our leader in the CBAHI chapter for laboratory, we see a lot of weaknesses in this area. And I think it's time to talk about it, get it analyzed, and then try to propose the solution for that to improve the counseling. This is it's always, you need to have a monitoring program within your blood bank. That could be doing, for example, indirectly through the donor counseling. You just evaluate the counseling activities through the donor survey, for example. Or it could be quantitative to measure your performance. Let's say if I have the prevalence of HIV or hepatitis B in my donor population this year, I need to do the counseling in order to reduce the prevalence, because effective counseling should reduce the donor who has risk factors for donating while they have a transfusion transmissible infection. So just to end, blood donor counseling is very critical, both to the supply and for the safety of the blood transfusion practice. And also, we need to do actually counseling as part of the quality management, as part of the blood donation process, taking care of the differences between pre, post, and intra-donation counseling. And also we have always to have think about the requirements and how we can make them available, especially and most importantly is having a national guidelines, a national policy for donor counseling and donor information in general. And also always quality is the most important to evaluate our performance. So integrating a quality system to evaluate the counseling practice in blood bank would help you to draw conclusion about your weaknesses and then plan for a protective or a corrective action in future. I come to the end of this presentation. Thank you very much, and enjoy the rest of the conference. Thank you very much.